Chapter 6. Financial Implications of All-Natural Breast Reconstruction. One of the first questions many women ask when considering all-natural breast reconstruction is, can I afford this? It is a very reasonable thing to ask because, unfortunately, financial considerations are something that must be factored into almost every decision that we make. Fortunately, in the United States, breast reconstruction is largely, but not completely, immune from financial considerations. The reason for this is the Women's Health and Cancer Rights Act. The WHCRA is a federal law signed in 1998 by then-President Bill Clinton that requires insurance companies to provide coverage for all breast reconstruction procedures. This includes symmetrizing procedures for the other breast in women who have breast cancer on one side. And it offers this coverage for women who have invasive breast cancer, as well as pre-invasive breast cancer, ductal carcinoma in situ, and lobular carcinoma in situ, and genetic predisposition, such as the BRCA1 and BRCA2 mutations, amongst others. The WHCRA has been a wonderful thing for women with breast cancer, as it has guaranteed the ability to undergo breast reconstruction for so many who might not have otherwise had the financial means to do so. But this liberation from financial concerns is not necessarily complete. First, this is because the WHCRA is interpreted differently by different insurance companies, and therefore some aspects of the breast reconstruction process, such as the type of breast reconstruction, implant-based versus tissue-based, or the number and type of revision procedures, are sometimes pushed back on when authorization is sought by the surgeon. Fortunately, this pushback is relatively rare, and when it does happen, is usually easily overcome. But that does not mean that it will always be authorized, and with some big picture shifts in economic and value-based considerations, it is possible that the WHCRA might not always be as universally accepted as it is now. So doctors and providers must remain vigilant and advocate for this very important and necessary legal protection. And second, there are not only direct costs associated with breast reconstruction, such as hospital bills, but also indirect costs, such as the financial implications of time spent away from work. Some women have family and employment situations that allow them to take an extended period of time away from those responsibilities and not suffer any financial implications. But unfortunately, there are many women who rely on each paycheck in order to make ends meet. And if they are unable to work for 2 or 4 or 6 weeks or more, then they and their families are significantly impacted. There's a whole field of scientific study of the topic of financial toxicity, and it involves total economic impact on a patient and his or her family as they undergo treatment for a certain condition. For breast reconstruction, is less about direct costs and more about lost wages because of time away from work, especially for unplanned complications that have a less predictable timeline and a variable length of time that they impact the ability to work. There's early evidence about the financial toxicity of each form of breast reconstruction, and as of now, it seems that it is roughly equivalent. But as more research is done, it will likely reveal that while one reconstructive approach has a lesser amount of financial toxicity than another, it is likely to be by a relatively small degree. Now that we have discussed the financial situation surrounding all-natural breast reconstruction, it's time to learn about the members of the reconstructive team. And similar to any other type of team, whether it's a sports team, a dance company, or a political campaign, the outcome that is achieved is most closely correlated with the quality of the entire team. So in the next chapter, you will learn more about the different roles on the breast reconstruction team and how you can assemble the best team.